Hello viewers, this is I Want Second Opinion. Today we have got Professor Raveendhran, Head of Department from Department of Pediatric Surgery. Dr. Raveendhran is a classmate of mine during my college days, and he is with us today with a fantastic topic that we are going to discuss, especially in pediatric age group. Hi, Prof. Raveendhran, how are you?
Hi, Prakash. Fine. How are you?
Yeah, I'm absolutely fine, Ravi. It's been many years, and thanks for giving me an opportunity to interview you. Thanks a lot. And once again, I really thank you for coming in and trying to help our viewers and giving insights about these pediatric topics. I look forward getting many interviews from you in the near future.
Prakash, it is my pleasure to interact with you and help the public with their medical knowledge.
Fantastic. Okay, let's jump into the topic straight away, Ravi. Today's topic has been first aid and insights about nosebleed in children. So, what immediate action, if my child develops a nosebleed, should I do?
It's a very important topic, Prakash, because nosebleed is a very common problem in children. Almost in outpatient department, we see 5 to 6 cases every week.
Right.
And the first thing the parents should do is they should not panic.
Absolutely.
No nosebleed is going to harm the child greatly, although it may look alarming to have the bright blood flowing from the nose.
Yeah.
What they have to do is they have to pinch the nose of the child and make the child lean forward, sit for 5 to 10 minutes. And that is why that 5 to 10 minutes is because that is the clotting time. And most of these nosebleeds are from small blood vessels. They will seal by themselves once the clotting factor activates in the blood, human body.
Okay.
And that 5 minutes, they should be patient enough to hold the nose, pinch the nose tightly, and allow the child to breathe through mouth. And the child should be leaning forward. This will arrest almost 90 to 95% of all nosebleeds in children.
Right.
The cause would be the nose picking and the trauma by the nose picking, which is called rhinitis digitorum. And most of them will stop bleeding by this time. Very exceptionally, there may be some cases where the bleeding may not stop. In that case, the patients can approach the doctor and have the proper prevention.
Right. Okay. So this 5 to 10 minutes of pinching the nose, that is the bit that the parent needs to be aware of, because they might pinch for 2 to 3 minutes, take the pressure off, and then the bleeding will come once again, and they will panic. It has been a bit of a time, and the bleeding has not stopped. So consistency is the important thing. Yeah.
Yes, exactly. What parents actually do the mistake many times is they will pinch the nose. After 1 minute, they have the curiosity to see whether the bleeding has stopped, so they will remove that. That should not be done.
Absolutely.
They should pinch the nose for 5 to 6 full minutes by clock.
Okay. And by pinching, how much pressure are you talking about here? Like it's a very vigorous pinch or a subtle pinch is okay?
Not the pinch should be gentle enough. That is sufficient. It should not be trying to cause discomfort to the child. Talking about a small child, when you pinch to the level of causing pain, the child will not tolerate the pinch and it will struggle, and that will produce actually more harm to the child by excessive bleeding.
Yeah.
It will be a gentle pinch, that is enough.
All right. In your wells you are mentioning that the child should lean forwards. What is the necessity of that? The child should not be laying back or anything, because whenever the nosebleed happens, it's a tendency to go back and lie down. But you are mentioning about leaning forward. What's the importance of that?
So nose has two openings, one in the front and one in the back. Common public may not see the rear side opening of the nose. Only a ENT surgeon by using a mirror will see that.
Yeah.
We are pinching the front openings of the nose so that sometimes the blood may collect inside and trickle on the back side. If it is going to lie down supine or in the back, there is a chance of aspirating this blood into the lungs, and that is more actually dangerous. So when you move forward, the chance of aspiration will become negligible.
All right. Okay, I understand. And also, we will not be able to see the blood that is trickling backwards as well.
Yes, exactly.
Right. Okay. So, what activities should the child avoid while experiencing the nosebleed? Is there anything that you would advise?
As I said, when the nosebleed has two phases, one is the active bleeding phase, and the second one is the controlled phase, when the bleeding is getting controlled.
Okay.
Active bleeding phase, the only thing they should do is pinch the nose till the bleed stops.
Okay. Okay.
Once the bleeding stops, there may be some blood clots inside the nose. They have a stuffy feeling for some time. So there is common tendency to blow the nose.
Okay.
So that is more dangerous for two reasons. When they blow the nose, the clot will dislodge and it will start once again bleeding.
Okay.
The second thing is the blood vessels are opened up during the process of bleeding, and when they blow nose with a heavy pressure, some of the air will be forced into the blood vessels and produce air embolism. So these are the two reasons why we should not blow the nose after controlling of bleeding by pinching.
You mentioned about air embolism. What exactly do you mean by air embolism to the knowledge of the general public, please?
Yes, exactly. Air embolism is a phenomenon in which if there is a breach in the blood vessel, the outside air will go into the circulation. And when it goes in large amount, it may block some of the important blood vessels that are going to heart and lungs. That may be actually very dangerous to life.
Right. Oh, okay. So a simple nosebleed, if it's not done properly, it can be dangerous as well.
Yes.
Is it something to be worried about or to be panicked about? Or it's an overreaction or over cautious side that we are talking about here?
Yeah, for any childhood injuries, the first thing parents should do is not to panic. They panic. In their anxiety, they will do many more wrong things and complicate the situation.
Exactly.
So a cool, calm approach to the problem will most of the times be very productive.
Exactly. Okay. Now, in what situation should the parent consider seeking medical help for the children's nosebleed?
Once the bleeding is arrested and stops, the acute problem is over. But they should also work out the cause why it has occurred. Sometimes there may be underlying problems that may be the cause of the nosebleed. For example, a polyp in the nose, some bleeding disorders. The child may not have the capacity to have clotting of blood. So some of the disorders like hemophilia, bleeding disorders, that have to be followed by proper medical investigation. And the thing is, most of the times it is a very innocuous bleed, not very harmful. The commonest cause, as I told, was the nose picking. Children keep on putting their fingers into the nose, and that causes damage to the lining cells of the mucosa. That causes the bleeding. If that is the case, nothing need to worry further. But in a very minority of patients, say 3 out of 100 or 2 out of 100, there may be some serious underlying problem that has to be worked out by proper medical consultation.
Right. Okay. So that's a rare phenomenon. Okay. Now, if the bleeding continues for more than 10 minutes after pinching, if the bleeding doesn't stop, what would you advise to the parents?
Yeah, in case if it is bleeding continuously, even after 5 minutes of pinching nose, that means there is something else causing the bleeding, not the simple trauma of digits.
Okay. Right.
Usually, the injury caused by child's own finger will be in the front half of the nose. That is amenable very well for pinching.
Okay.
Suppose if it is in the back half of the nose, then it may not be possible to control the bleeding by pinching. in which case they have to seek the help of a surgeon or ear, nose, throat surgeon to have packing. The surgeon will pack the nose tightly with some gauze pieces and soaked with antiseptics and leave it there for 4 hours and remove it later after the bleeding stops.
Right. Okay. Now, if that is going to be the scenario, are parents advised to use cotton or any tissue to push in the nostril as a kind of a first aid maneuver at home, or is it not advisable?
Yeah, parents can use the tissue or anything outside the nose. That is no harm in doing that. But packing inside the nose should not be attempted by parents because they do not know the internal anatomy of nose, so that they produce counter injuries to the mucosa. That should only be done.
Okay. So, I understand what you mean here. Now, are there any seasonal variation in the nosebleed that can happen, or it happens in all the time at any particular point of time?
Generally, there is no seasonal variation of nosebleed. As I told, it is only a self-inflicted injury most of the time by the child himself or herself. Very rarely, allergic rhinitis is a disease that is linked to the seasonal variation of pollens, grains in the air. That type of allergic rhinitis may produce sometimes nosebleed. That may be seasonal. That is very rare.
All right. Okay. And if a child gets recurrent nosebleeds, after how many episodes would you advise the parents to come and seek attention? Because it's a distressing thing for the parents, and both for the parents and also for the kids. Now, after how many episodes do you advise the parents to come and seek medical attention?
It is not a question of a number of episodes. As I told, even after the first episode, they should have a proper workup. Because suppose there is an underlying problem like bleeding disorder, nosebleed will be the first manifestation. And it is better to investigate the child and rule out all the underlying causes, both anatomical as well as blood-related disorders. Even after the first episode is getting controlled by home remedies.
Right. Okay. So it's better not to. Go ahead.
Once the first aid controls the bleeding, the acute problem is over. They can seek the consultation of a doctor and then do the proper workup to rule out the underlying problems.
Okay. Now, considering the situation that there is no serious underlying problem here, and if the child has got the tendency to have recurrent nosebleeds, are there any tips or advice that you would give to the children or to the parents so that these kind of nosebleed doesn't happen in future? Like any creams or anything that are available that the kid or the parent can help with the child with?
As I told that suppose if there is no serious problem underlying the nosebleed, like bleeding disorders or nasal polyps, etc., then the commonest cause is child's own finger-induced injury, minor injuries to the mucosa. The first thing that parents should do is to advise the child not to do nose picking frequently. And the second thing is that the nails very close so that the nail-induced injury will be minimized. And there are no effective applications like ointments to prevent this.
There's nothing
this
at
is
all.
mechanical injury.
Right. Will a dry nose lead on to a scab formation as a result of which the bleeding can happen at all? Is that a possibility or?
Yes, that is in dry climates like desert climates or in extreme cold climates, that is possible. For which they can have two solutions. One is artificial tear or artificial saline application can be done very frequently. Or they can apply Vaseline over the inside of nose.
Vaseline? Okay. It's a kind of, all right. In what way does it help, Prof?
Vaseline is a oil-based material. It's an inert material, will not have any body reaction.
Oh,
So it prevents the evaporation of water from the lining cells of mucosa and keep them wet so that it will not become dry and produce bleeding.
right. Okay. So it's okay. That makes a lot of sense. Fantastic. Now, in order to conclude this one, is there is any specific piece of advice or information that you would want to pass it on to our general public, to the parents and both to the kids regarding this particular scenario?
Obviously, I would emphasize the first point which I told.
Never panic.
Not panic, because
Yes.
some of the nosebleeds are harmless and are self-limiting, provided we keep a calm, cool approach to that.
Yes. Majority of the times what happens is even a single drop of blood in the handkerchief will look like a big one. And whenever the child bleeds, it's the first thing for the parents to panic. Oh, my child has lost this much amount of blood. But not to panic is the basic thing. Fantastic, Prof. It's for great use, and I'm sure the viewers would be benefited from the information that what you have provided. I look forward seeing you in many other health videos that you are going to kindly offer us. Thanks, Prof. Appreciate it.
Thank you, Prakash, for the opportunity to interact.
Fantastic.